Hi, my name is Abigail Doherty, and I am a junior here at Medaille College, and I'm a psychology major. Today I will be presenting my capstone project on my digital portfolio on Pathwright. So my capstone project is called Misunderstood and Misdiagnosed. It's a comprehensive look at the effects childhood trauma has on the brain and development and its implications for therapy. I have included my physical paper in sections on this website, so anyone is able to read it in its entirety with access to the link. My thesis is that some psychologists believe that therapy types such as traditional talk therapy or cognitive behavioral therapy are the best treatments for childhood trauma. These therapy types have a wide array of support because therapists use these techniques for decades to treat a variety of different psychological disorders for adults and children. However, newer treatments such as play therapy and trauma-informed care are more useful. I will begin by highlighting 5 areas of the brain that are negatively affected by childhood trauma. These are neurons, the limbic system, the prefrontal cortex, the anterior cingulate cortex, and the development of psychological disorders. I will then be providing an overview of traditional therapy types, and then I will argue against them in the last section. I will start with 2 definitions that I will be using throughout the presentation. The first is trauma. Now, there is not one specific definition of trauma, but one that is commonly used, stated by Mrinalini Mahajan in an article on childhood trauma and treatment. It states, trauma is any event, usually out of the ordinary, that causes physical and psychological damage. It covers a broad range of experiences, including physical, sexual, mental, or emotional abuse. Mahajan gives another definition of adverse childhood experiences, which are traumatic events that happen to children from 0 to 18 years old that can be assessed using a questionnaire. The higher the child scores on the questionnaire, the more adverse childhood experiences they have faced. ACEs are detrimental to a child's physical, mental, and emotional well-being. I will often interchange adverse childhood experiences and childhood trauma. The first image from one of my many sources on the effects of childhood maltreatment by the Child Welfare Information Gateway shows how our brains develop. Development does start from the bottom up with the brainstem, which controls basic functions such as body temperature, heart rate, and blood pressure. As the brain continues to develop, more complex functions develop as well, such as abstract thinking and concrete thought. This complex function occurs after basic survival functions, but the whole brain develops rapidly during the first 3 years of a child's life. A child's entire brain can be damaged by trauma, which can lead to lifelong social, emotional, and behavioral issues. Because the brain develops so rapidly in these first 3 years of life, trauma is especially dangerous. This is an image of a neuron, which is the part of the brain that makes connections and sends messages to other parts of the brain in the body. We are born with millions of neurons, more than we will ever need. This is because neurons and their connection points, called synapses, are a sort of pre-wiring in humans. Synapses form due to our experiences. Those that are strengthened by constant exposure remain, but those that are not are pruned or faded away. For example, we are born with the neurons that allow us to understand multiple languages. But if our household that we grow up in only uses English, the neurons and synapses for learning and understanding English will be strengthened, while those for, say, Spanish or German will disappear. These connections can be remade later in life if one chooses to learn a new language, but it will be much more difficult to relearn. The connections will not be as strong either. In the case of trauma, if a child is neglected and does not hear any language at all, which does happen, those connections for all languages will disappear as well, making it difficult or even impossible to relearn any languages later in life, according to Mahajan. Children who suffer neglect or maltreatment may lead to the inability to form secure attachments, use or understand language or emotions, or understand behavioral norms. This is the limbic system. It consists of the hypothalamus, the thalamus, the hippocampus, and the amygdala. When a healthy brain's amygdala sees a frightening object or is in a scary or stressful situation, it sends a message to the thalamus to relay to the other parts of the body to elevate your heart rate, breathing, and hormones to be prepared to fight, flee, or freeze. When the object or situation is no longer seen as a threat, the amygdala sends the message as well, and the hypothalamus comes into play to regulate your body. The hippocampus remembers that situation or object and will remind the other parts of the limbic system how to react the next time it occurs. The limbic system is arguably the most important brain region in regards to trauma because this part of the brain is crucial for fear processing and handling stress. There are 3 types of stress, as described by the Child Welfare Information Gateway in Mahajan. The first type is positive stress. This is normal and healthy in a typically developing child. Examples are small stressors from day-to-day experiences, such as these listed in the picture, like a deadline, time management, or stress at work. The brain adjusts to these easily, which promotes resilience and healthy development. The next type of stress is tolerable stress. This refers to a high-stress event that occurs very infrequently. An example would be moving to a new place or a death in the family. A healthy developing brain should be able to adjust. However, this takes a lot longer and is heavily influenced by the amount of support an individual has. The last type of stress is toxic stress. This negatively impacts several areas of the brain and is defined as constant, prolonged stress. This means that the brain's limbic system is always overactivated, which results in a fear response that reacts negatively to even harmless stimuli. It also causes an abnormal level of stress hormones. Trauma is a kind of this toxic stress. The National Scientific Council on the Developing Child from Harvard University, as well as Mahajan again, state the differences between healthy development and toxic stress or trauma and stress hormone levels released by the limbic system. In healthy development, there are elevated cortisol levels in the morning and then a steady decline throughout the day. Stress hormones are elevated in frightening situations, but are normal in harmless situations. However, in individuals who have been through trauma, their typical levels are low in the morning with a plateau throughout the day, and hormones are activated constantly even in harmless situations. Many studies also have shown significant results for changes in the limbic system, including smaller hippocampal volumes, weaker amygdalas, higher levels of association. There are also differences in adult and childhood trauma because a child's brain is not fully developed. So many findings do not report size differences until adulthood, but children's brains are harmed even at a young age. Trauma can affect the hippocampus as well by negatively impacting memories and perceptions of the world. For example, as stated by the Child Welfare Information Gateway, a child may not remember the exact details of a traumatic event that are called explicit memories, but they will remember the feelings that they had during the event called implicit memories. This dissonance in remembering causes flashbacks, nightmares, or other uncontrollable reactions, as well as an inability to trust, communicate, or socialize. The next area is the prefrontal cortex, which is responsible for executive functioning. It's at the very front of the brain. Sorry. There we go. Executive functions are planning, decision-making, impulse control, short-term memory, and reasoning. The prefrontal cortex is not fully developed until the age of about 25 years old. The pink boxes on the top describe what happens to the prefrontal cortex as a result of trauma. These include lower neuronal activation, lower gray matter, functional impairment, and volumetric differences. These all result in the blue boxes on the bottom: decreased attention, intellectual impairment and lower IQ, weaker impulse control, more academic achievement, more negative emotions, and inability to solve problems. Multiple sources have also supported this information as stated on the slide. This is a child's internal working model. It states that behavior is modeled by a child's first interaction with a caregiver. If a child is abused by a caregiver, the child will not know how to properly behave and will not be able to categorize good and bad experiences in their prefrontal cortex. This idea is also supported by multiple sources, including Mahajan, Sungkeen et al. And the National Scientific Council on the Developing Child. This is the anterior cingulate cortex, which is located in the cingulate cortex in the center of the brain. According to Zhu Wei Zai et al., in a study on the effects of childhood trauma on the anterior cingulate cortex, or ACC for short, the ACC is involved in inhibitory control processes and emotional regulation and is also related to our stress system. Children are not born knowing how to handle emotions. It is the job of the caregiver to set the example and teach the child about how emotions look and how to express them, according to the National Scientific Council on the Developing Child and Zai et al. This process is called co-regulation and is essential for empathy, effective communication, resilience, and understanding. In an article by Jonathan Levi et al. On neuronal development and empathy, he states all the following can happen as a result of trauma. Child-caregiver interactions are very important, and emotion has a critical period early in life. Neglect and maltreatment can leave children confused and unable to recognize emotions, which is due to trauma altering cortical networks of the ACC. Thus, empathy can be delayed or even impossible. Many other studies on emotional development and trauma state these deficits as well. Coping mechanisms are lessened, dissociative states or states of anger increase, neuronal loss and reduction of cortical thickness in the ACC, altered structure and function of the ACC, and cognitive deficits and inhibitory control throughout adolescence. Social behavioral problems that occur because of trauma altering the brain can result in psychological disorders in children or later in life if untreated. Social behavioral problems as a result of trauma that have been discussed from previous subsections include lack of empathy, limited problem solving, diminished sense of self, lower cognitive and intellectual abilities, and delays in developmental disabilities. Milestones. In a study by Amy Badura-Brack et al. On childhood trauma and brain volume, a common diagnosis pattern occurs. First, trauma causes problems that lead to problems at home and school. That leads to misbehaving and disrupting those areas of life, which then leads to the diagnosis of psychological disorders in adolescence. According to studies by Popovic et al. And Kay et al. On multiple disorders, trauma significantly increases the risk and severity of psychological disorders such as PTSD, anxiety disorders, and depressive disorders. Sometimes trauma is also the cause of these disorders. And although trauma can increase the severity of psychotic disorders such as schizophrenia and bipolar disorders, it does not cause them. According to this slide, trauma can also increase the risk of substance abuse disorders because of a decrease in neurotransmitters in the brain, causing children to seek these endorphins elsewhere. I will now discuss two methods of treatment that have been very popular but are older forms of therapy. Courtney Evans, in her article on trauma treatment, states that traditional psychotherapy, also called talk therapy, is listed by the National Child Traumatic Stress Network as a helpful intervention for childhood trauma. It has been used for decades as it is the oldest form of therapy and has been proven to be effective in children and adults. Mahajan states in their article that talk therapy can restructure neural pathways because physically talking about an experience can rewire the brain. However, like I stated before, these connections will be weaker. Evans also discusses trauma-focused cognitive behavioral therapy. This is also recognized by the National Traumatic Stress Network as an effective treatment of childhood trauma. It's one of the most researched and supported methods of therapy. It is like cognitive behavioral therapy, but does use more techniques that are focused on trauma, and it does incorporate exposure and parent interaction. Trauma-focused cognitive behavioral therapy has steps of treatment that make the acronym PRACTICE. It stands for psychoeducation and parenting skills, relaxation, affective modulation, cognitive coping, trauma narrative, in vivo exposure, conjoint sessions, and enhancing safety. Mahajan also discusses strength of trauma-focused cognitive behavioral therapy with psychological disorders. This treatment can alter blood flow in patients with social phobias, the limbic system in patients with depression, brain metabolism in patients with panic disorders, and the ACC in patients with PTSD. Overall, these methods are effective in treating childhood trauma. However, there are newer methods that can be more helpful. The first therapy type that I'll be arguing for is play therapy. The goal of play therapy is to create an environment of safety, trust, and comfort, process traumatic material, encourage social reconnections and hope, and return to pre-trauma developmental functioning. There are two types of play therapy that I will be discussing: Adlerian play therapy and child-centered play therapy. Although they do have differences, they are similar in the fact that they are child-focused, allow for open communication, have a priority of safety, and are being used increasingly more by psychology professionals. My thesis for this section reads, although play therapy is relatively new and does not have as many studies as traditional therapies, it is being used more by therapeutic professionals because play therapy is more comfortable for a child, it is more inclusive in all types of trauma, more flexible in its methodology, specifically focused on children, and helps foster brain redevelopment. Play therapy is more comfortable for a child. It does not seem like therapy. Play is a natural part of development, as stated by Gaston Ort and Locatelli. By using toys or crafts, it eliminates the direct nature of therapy. This allows the child to distance themselves from their trauma while seeing it from a new perspective. So therefore, a child could say, this happened to the bear, and the therapist could ask, what happened to the bear, instead of what happened to you. A child can present themselves differently through play. They can be seen as the perpetrator, they can be seen as a powerful figure, they can be seen as a bystander, and that shows the therapist at what happened during their trauma. Play therapy is inclusive of all types of trauma. Trauma-focused cognitive behavioral therapy that I stated before is mostly focused on sexual abuse and sexual assault trauma. However, play therapy is inclusive of all these types of traumas, as stated by many different case studies. Some types of trauma that play therapy has benefited is PTSD, also children with autism and different learning disabilities. Also, Haas and Ray compared cognitive behavioral therapy with child-centered play therapy and found better results with refugee trauma. There's also better results for medical trauma, and also reduces symptoms for multiple types of trauma. Play therapy is also flexible in its methodology. Traditional therapies such as talk therapy and trauma-focused cognitive behavioral therapy have rigid steps. The child is the leader in play therapy. The child may be in a different place developmentally than steps suggest, so play therapy is more free and more flexible. And play therapy focuses on the relationship with the child first. Play therapy also has the ability to use non-conventional techniques such as the superhero effect and storytelling. And play therapy can restructure the brain in many ways. By neurons having a positive adult can form attachment connections and trust and impulse control. It also releases endorphins during play and enjoyment. There's maturation of the frontal lobe, reorganization of brain systems to foster positive development, and co-regulation and emotional expression from this trusting adult. The next therapy type I will be focusing on is trauma-informed care. It is not an interventive method. It is a preventative method. So trauma-informed care approach requires that the individual look through the lens of what happened to the child rather than the traditional focus of what is wrong with the child. Like I said, trauma-informed care is preventative. It's communication with the entire family and the community circles rather than just the child one-on-one. This involves professionals in every aspect of a child's life, so they will get educated and informed on childhood trauma and what it does to them. And these professionals will be able to step in, hopefully before the trauma occurs or before the trauma gets worse. My thesis for this section reads, trauma-informed care is not only more beneficial than traditional talk therapy and trauma-focused cognitive behavioral therapy, but also play therapy. This is because it is multifaceted, judgment and diagnosis free, and free of cost. Trauma-informed care is multifaceted. It's not limited to weekly sessions in a therapist's office. It includes teachers, government services such as Child Protective Services and Child and Family Services, and even medical professionals. Neuronal pathways are not being strengthened outside the office if a child returns to a traumatic location or situation. Therefore, neuronal pathways will be strengthened constantly in this approach. It's not intimidating because these adults are the adults that the child normally interacts with, and they're more likely to build resilience if support is constant. Trauma-informed care is also judgment-free. Children in school settings who have behavioral problems are often put in special education classes or are labeled as having a disability. Acting out often gets punished, but what the child really needs is listening and communications of feelings and situations at home that a trauma-informed care professional could provide. The child may be acting out because they don't know how to express their feelings any way else. The earlier the child does have support, the less likely the symptoms are to continue or even present in the first place. Trauma-informed care is also free of cost to the family. This is not a private specialized form of treatment, so there is less need for later intervention that costs a lot of money to the family. This could be a lot given that these professionals all need training, but this would not be out of the pocket to the families of the children who are suffering. Many children also do not get help that they need due to the high prices of therapies as stated by Jordan. In conclusion, trauma is severe. There are problems in every aspect of the child's life that can occur from trauma. Research does support that childhood trauma can alter brain structure and function in children from a very young age, and trauma needs to be treated or prevented. In neurons and synapses, essential connections can be discarded as a result of trauma. Learning and typical development can be very difficult. In the limbic system, it impacts stress hormone levels and alters reactions to fear. In the prefrontal cortex, it has diminished executive functioning. In the anterior cingulate cortex, there's lack of emotional regulation, expression, and communication. And in diagnosis of psychological disorders, social and behavioral problems in every area of life can cause this, and these symptoms can present earlier and more severely. For treatment, talk therapy and trauma-focused cognitive behavioral therapy are not as effective as newer treatments. Play therapy and trauma-informed care take into account the complexities of trauma and how children are affected. Play therapy is inclusive of all trauma, more comfortable for a child, more flexible, can include non-conventional methods of treatment, and helps restructure the brain. Trauma-informed care would be the most beneficial because it involves adults who are already in the children's life that can help build resilience, is no cost to the family, and ensures the child will not be misdiagnosed or mislabeled. It will also take a while for trauma-informed care to be implemented in our country, so therefore play therapy is the most beneficial treatment we have at this time. Thank you so much for listening to my presentation, and I will also include the link if anyone wants to click through and read the entire presentation or the paper in its entirety. Thank you so much for this opportunity, and I really enjoyed giving my presentation. Thank you.